Good morning. Hey guys. So I just wanted to talk to you about IVIG. IVIG is a specialty infusion. IVIG meaning intravenous immunoglobulin. It goes through the venous route. So the patient must have some kind of venous access, IV access to receive IVIG. So with IVIG, it's an immunoglobulin. You often see it administered with patients who have autoimmune disorders, meaning that the body is attacking itself. Not all patients, it just depends on what the doctor feels is best based on the tests that they've run. It depends on what the doctor feels is best for that patient, okay? And oftentimes these patients will have neurologists that they're seeing. They'll be seeing endocrinologists, different types of doctors, to even get to this point of of administering IVIG, okay? So IVIG, depending on the dose, will come in some kind of bottle. So depending on the dose and depending on the company that makes it, right? So IVIG, so this is Gamunex C. So this is the brand Gamunex C. There's different types of brands, but the one that I'm administering is called Gamunex C. You can see it's an immune globulin. Okay, and you can see this is a 40 gram, 400 ml bottle. There is also a smaller bottle, which is a 5 gram, so 5 gram, 50 ml. So it just varies depending on the dose, depending on the manufacturer. So IVIG, a couple things you need to know about it. It's pretty thick. So IVIG medication is thick. If you've ever given albumin, I would compare it to the consistency of albumin. So make sure you have tubing, or you have the appropriate tubing for this, okay? Because you're gonna need that specific tubing that that can prime thicker medication. Okay, so make sure you're aware of that as well. With IVIG, you want to make sure you follow the directions. Don't freeze this thing, okay? And just like any other medication, you're going to assess it to make sure it's clear and not cloudy and not like random particles everywhere. This just has bubbles because I just emptied it into a bag, okay? So once you've finished it, you'll just see, yeah, this is what it looks like post draining it into an IV bag. I know some people, depending on how much they're given and depending on if they have the appropriate tubing, you can just administer it straight from the bottle itself. But yeah, because I was giving 3 bottles, I'm not doing it. I just put them all into a single bag, and that's how I did it. So you can hang it upside down and just prime it here, like spike it here with your tubing and administer it like that. As you can see, there's a little hook. That little pink thing comes off and makes a hook for you to hang on the IV pole. Okay, so let's talk about IVIG, guys. So with IVIG, you want to make sure you're monitoring your patient. Okay, it's an immune globulin. So the way I always remind myself is I treat it like blood, like when I'm administering blood, right? So the main thing we fear concerning blood is an adverse reaction, patient having a reaction to the blood. Think about it the same way with IVIG. You don't want that patient to have a reaction to the IVIG. So you want to make sure you're monitoring them. So you always get pre-vitals. So take vitals before you even do anything. So before I even pre-medicate the patient, whatever it may be, I take a set of vitals, get a full set of vitals so you have a baseline, right? So you know, this is where my patient started out. Okay, so if you have to give a report, you're like, hey doc, before anything, the patient had a blood pressure of this, had a heart rate of this, had a temp of this, respirations were this, so you have that baseline. Get yourself a set of baseline vitals, and also a set, just ask the patient how they're doing pain-wise, okay? So once you get that, you do your pre-medication, depending on whatever the doctor orders. It might be some Benadryl with some Tylenol. Let that medication kick in, okay? Let it kick in, it's gonna help. Once the pre-medication is done, then sometimes they'll do a pre-bolus. I've had patients where they don't do any bolus at all, okay? So it just varies from patient to patient. So they'll do a pre-bolus of normal saline or any other IV fluids based on what the doctor orders. Pre-bolus of normal saline, you finish the bolus, and then you start your IVIG. Before you start your IVIG, I always get another set of vitals, okay? After that pre-bolus, get a set of vitals, and then we start IVIG. Once you start IVIG, just like blood, you're going to monitor for 15 minutes. You're going to be in that patient's face, one-on-one. You're looking at the patient for 15 minutes. Get your first set of 15 minutes vitals, okay? IVIG, depending on your doctor's order for the order that I have and what we do 15 minutes times 4 for the first hour. So every 15 minutes for the first hour. And then we go to 30, and then we go to 1 hour. Okay, so we do monitoring 15 minutes set of vitals. So set of vitals over 15, 15, 15, 15. We want to make sure the patient's not having a reaction. Things to kind of watch out for: if the patient's temperature all of a sudden spikes, if their respiration changes, whether it goes up or goes down, if their heart rate all of a sudden spikes up, they're like they were chilling at 70 and all of a sudden they're like 120 and they haven't moved, they didn't get up to go to the bathroom, they didn't do any strenuous exercise, stuff you want to make sure, take a look at their skin, make sure they're not having any rash or any breakout to it. Those are really some signs you can kind of watch out for to see if they're having a reaction, okay, to the medication. Make sure you always have your emergency kit ready. So your anaphylaxis kit, so it's usually epinephrine. Sometimes I think they'll put some Tylenol or something in there, something else in there, but just make sure you have that kit ready to administer the patient in case they have a reaction, okay? Couple other things I'm trying to think of. Just like blood, if they have a reaction, you want to stop it immediately, okay? Don't say, oh, let me finish this bag. No. You want to stop and disconnect right away. Get yourself a set of vitals, administer the medication, right? The emergency anaphylactic medication, especially if you're in the home setting. If you're in the home setting, it's really just you and that patient. Administer that. If you don't see any improvement, I would just call 911. Call 911, get that ready. Let them know what's going on. Even if you're just calling them to say, okay, hey, the patient just had a reaction. I just administered some medication. I'm just calling you guys just to be on standby in case something happens, in case the medication doesn't kick in, okay? I'm trying to think of what else to tell you. Don't be scared of administering IVIG. A lot of nurses think, oh my gosh, IVIG, it's a new thing. Just think about the way you monitor blood. The blood, not the same exact way, but if you can administer blood and you're confident with administering blood, meaning packed red blood cells, not platelets, it's a little different, platelets, you want to make sure that you kind of keep the same routine and a little bit more when it comes to IVIG, okay? So that's pretty much it. So, and then oftentimes after the IVIG, sometimes there will be a post-bolus, usually 0.9, depending on what the doctor's order. You give that patient the bolus. The rate of the IVIG will depend on what the doctor orders and also how the patient tolerates it. If the doctor orders something higher and the patient can't tolerate it at that rate so high, then you're going to have to alter it to lower it a bit. Okay, so you want to make sure you are monitoring your patient because at the end of the day, it's your license on the line as the nurse, and you want to make sure the patient comes first. Okay, let me know, guys, if you have any comments about IVIG. Anybody actually doing IVIG? I know there's a ton of nurses out there doing home infusion IVIG. Let's connect, guys. If you have any questions about IVIG, put it down in the comments below. Feel free to connect to my channel. I will be making a lot of educational videos for nurses, and also some funny videos for nurses because we gotta laugh too. Yeah, okay. And excuse the mask, it's because I'm actually at an infusion right now, so I have my mask on and I got my gloves on. Anyway, so I gotta go. I have to go start the IVIG. Patient is finishing up their pre-hydration bolus, and we're gonna go get started on IVIG. Okay, take care, guys. Bye.